Tonshi, Malolole, bonjour, good afternoon. It's great to be gathered here with honored guests, family, and friends. To our outgoing President, Dr. Smart, thank you for being an authentic and fearless voice over the last 12 months. You've taken us down uncharted paths as we walk towards an uncertain future. You were the voice we deserved and needed in these troubled times. When I was in grade school, I was labeled with a learning disability. Without involving my parents, the school placed me in speech therapy. Months passed with little improvement. Becoming aware of the issue as it progressed, my parents requested a meeting with school administrators, where they were informed that my diagnosis of developmentally delayed with a speech impediment was likely untreatable. All the dreams my parents had for me evaporated in that moment. I remember being in our vehicle after, my mother holding me in her arms, telling me over and over again, I wasn't broken. My mother is a first-generation immigrant from the South Pacific island of Tonga. She came to California with my grandfather not speaking English and was the first of 14 family members and multiple extended family members that they helped in coming to America. My father grew up in a farming community called Lestock in Saskatchewan, inheriting his Métis, Cree, and Ojibwe ancestry from my grandfather. He was the first person in his family to attend university and the first to obtain a master's. For years, he taught, managed, and built knowledge translation programs, and was now confronted with a learning challenge he was told was without hope. After the initial devastation of my diagnosis, my parents were left alone with the question of what to do now. Only they could carry the burden of fixing this problem that cut to the core of their hopes, dreams, and hearts. Our health system is collapsing around us. Wait lists have transformed into multi-year queues. Community and hospital-based access is now so unstable in parts of the country that closures are commonplace. The sustainability of the generalist family physician has never been at greater risk than it is today. Around us is the steady call for disruption, ever more cost-cutting, and dismantling of our publicly funded Canadian healthcare system in favor of a privately driven replacement that will surely continue to reach a fever pitch in coming months. Canadian physicians are fighting a growing tide of fear, dissatisfaction, and anger from the patients that we've dedicated our lives to serve. If you feel hopeless right now, you're not alone. As I reflect on being the first Indigenous president of the Canadian Medical Association and one of its youngest in its 155-year history, my mind and heart are brought back to that moment in my mother's arms, reassuring me that the future written by accepted wisdom was not wise at all. I wish I could share with you a magic formula that my parents applied, but it was actually very simple. My parents leaned in to acknowledge the feelings that they were experiencing. They took the fear, frustration, and confusion they felt in the moment and asked themselves the question, who knows their child best? Is this opinion or fact? Did the solutions that were applied actually solve the problems? How could they work with me to iterate towards better solutions? What should their priorities be, and what kind of child were they trying to raise? My mother gave up her work life to invest hundreds of hours into my learning. She became involved in the community association and school board to corral resources from elsewhere. My father applied different teaching methods, recognizing the physical and auditory barriers I had to learning. They placed me in Taekwondo. They started a family musical group that became a 2-decade experience in a boy band. And they assigned me the roles where I could have repeated exposure to public speaking. Years later, I was labeled as gifted. I graduated high school at 15, a bachelor's at 19, and medical school at 23. Colleagues, there is a template for us to apply in the chaos that we are experiencing daily. Lean into the negative feelings we're experiencing by leaning on each other. Remind ourselves of the deep knowledge that we have of these problems and the opinions that we will have to reshape in changing our system. The partnerships with nurses, patients, and other allied providers who are so essential to true team-based care. The Canadian Medical Association is focused on confronting the various problems that we face. Together, we can shift the priorities of a health system obsessed with cost-cutting and patient volume at the expense of all else, towards a sustainable health system that treats its providers with dignity, its patients with respect, and prioritizes safety, quality, and teamwork above all else. This week, the Canadian Medical Association is releasing the 2021 National Physician Health Survey. It underscores how much the pandemic has damaged physician well-being. 6 in 10 respondents indicate that their mental health is worse now than before the pandemic. More than half of physicians and medical learners experience high levels of burnout, and nearly half of respondents are considering reducing their clinical workload in the next 24 months. Along with the additional stresses of the pandemic, physicians are reporting bullying and harassment, high administrative burden, and lack of professional fulfillment, among other problems. As I take on the role of president, I want you to know that you are important to me. Seeing your struggles, hopelessness, and pain is why I ran to be CMA president. By serving you, we will amplify your ability to serve patients. In the 155 years that the CMA has existed, there have been few times of greater uncertainty. But with that uncertainty comes opportunity, because change is not only possible, it is necessary. The status quo is no longer an option. Together, we will rewrite the narrative of what it means to be a physician, how to better partner with patients in team-based care. Together, we will build a future for healthcare in Canada. Thank you.